Clive Palmer is digging deep in the battle against coronavirus. The billionaire businessman has agreed to fund more than 1 million doses of an anti-malaria drug, which could help fight COVID-19. A small number of coronavirus patients have already been treated with the medication. It comes after Mr Palmer announced a $1 million donation to the Royal Brisbane and Women's Hospital Foundation Coronavirus Action Fund. Clive Palmer joins us now from the Gold Coast. Clive, good morning. How confident are you that this anti-malaria drug will work against COVID-19?
Well, this morning in Jordan, the United States and France, people are being treated with the drug, and it's become the official treatment in Jordan and also in France and also in the United States. President Trump has said it can be used for compassionate reasons. That's why I funded the trial 2 weeks ago. But that was based really on the clinical results that had happened in France, where it showed that 50% of the virus was treated successfully within 3 days and 70% within 6 of the patients that underwent the treatment. Admittedly, it was a small sample. But a similar result was held in China, where they had over 100 people in the trial. So that's why I funded the trial here, to make sure it would happen. But now we have to look to how we can deliver this once the government allows us to the Australian people. And I'm sure the Australian government's very receptive to this, and I think they're doing a great job. And you know, we have a daunting prospect of there could be thousands or millions of people being affected, and a lot of people have talked about a vaccine, but a vaccine's to prevent you getting the disease. We have to look at what we can do when people do get the disease. So that's why I've put whatever money I've got available to scale this up as soon as we can, so that we can have enough material available for all Australians free of charge.
Yeah, Clive, it's really promising, isn't it? How will people be able to access the drug, and how soon?
Well, firstly, the drug is already approved for use in Australia, has been used for over 60 years to treat malaria, so we know there's limited side effects, so there's no downside really in doing that. And it has been accessed normally in Australia through chemists, and a normal bottle where you take in the case of coronavirus, it would be 3 tablets a day. But yesterday, of course, there was a restriction placed on the drug in Australia, and the United Kingdom has put a ban on all exports of the drug for the UK. So we here in Australia must do all we can to make it happen. At the moment, I'm trying to source on international markets not 1 million doses, but 30 million doses. 1 million courses that can be acquired quickly. I don't know how quick we can do that, but any funds that are required are being put behind it, and we hope we can make an announcement in the next couple of weeks. We also need to manufacture the drug, and we're in discussions, and the health department's been in discussions with manufacturers in Australia, and I've indicated that I'm happy to pay whatever it takes to provide the facilities so that we can have that on a long-term basis, because coronavirus could come back next year and the year after, and if we look at it, we've got to be self-sufficient in this country to treat our citizens, and that's what we really have to do.
Wow, that is so promising. Good luck on this, because you know, we've been hearing for weeks from these scientists in Queensland that this could be the answer, Clive. So thank you very much for joining us, and good luck.